Hello, I'm Kaveh Madani, a senior fellow at the Yale's MacMillan Center for International and Area Studies. Today, hosting colleagues in the water sector in another discussion on the COVID-19 topic. I'd like to ask my guests to introduce themselves.
Hello, my name is Hossein Ashktorab. I'm the manager of water resources in Clara Valley Water District, which is located in the heart of Silicon Valley in California, USA. And I'm mainly responsible for recycling and purified water.
Hi, my name is Ali Mirchi. I'm an assistant professor of water resources engineering at Oklahoma State University's Department of Biosystems and Agricultural Engineering.
Hossein, what are the general implications of COVID-19 for the water sector? How is COVID-19 related to water?
So this COVID-19 has been impacted almost everything in the world, and not exception in the water sector as well. But I believe the water has not been impacted as much as the people were scaring, and they thinking that not only on the water side, but also wastewater side has been impacted. And there are more rumor and there are more fear about the water quality than actually existed. So, especially for most of the countries that they have treated water for drinking water, we don't see anything. The data has not shown anything happening. And the World Health Organization came out with data that actually the water is safe to drink, and there's nothing in the water that they should be worried about related to COVID-19.
And you're specifically referring to treated wastewater, or does this apply to places where people don't have access to clean tap water?
So in that regard also, there's not that much study yet, but again, of course, if you don't have treated water, it could be anything. Any pathogen can cause any issues not related to COVID-19. However, most of the countries that they are having some sort of drinking water that's treated, including Iran and of course United States, there's nothing to worry about in terms of drinking the water. In the wastewater side, that's a different story. So the wastewater, if it's not treated, it could be impacting groundwater, but how much is going to impact, that's unknown. Based on the recent research that we have done in our area here, because we're using groundwater, we see some septic tank that's not treated is going down to the ground, but it is not showing any impact on water quality. So both in terms of the treated wastewater that using for recycled water and also non-treated, when it goes to the ground, it has not shown, at least to the extent that we have seen so far. This has to be long enough to actually coming up with the data that shows for a year or so if it's impacting the groundwater, but it hasn't been impacting the water quality.
That's a great news. So at least what we are hearing from you as a practitioner is not as scary as what we hear in the media. Ali, what do you think? What are the implications?
Well, thankfully, on the water supply side, the technologies are advanced enough to deal with different pathogens. So on the supply side, there's not much concern about water acting as the primary medium for transmitting this disease. I guess, because water plays a major part in combating this virus and the spread of the virus, the major concern is people's access to water in rural areas, primarily in developing countries, for example. Currently, as we speak, about 3 billion people lack access to safe drinking water, and that becomes a huge issue when you want to maintain, hygiene and apply hand washing practices. So I see a problem in that area. How lack of access to clean water can help prolong this pandemic and increase the number of cases infected with the disease.
And then for other sectors, do you see any implications in the agricultural sector or environmental sector?
Well, not really. In terms of water supply, that hasn't been a real limiting issue. Now, there is some conversation about how wastewater in areas that lack advanced technologies for treating wastewater, how the virus can move in raw wastewater and sewage. But again, the evidence so far doesn't suggest that is the major concern. I guess maintaining personal hygiene just to stay safe is the more critical issue at hand nowadays.
So I wonder if we can assume that things actually in the environmental sector are positive, because with the lockdowns, with the limited activities, more water being delivered to the environment. Because there are not so many users upstream, but that's not sustainable, and things can change in the long run. Plus, that can have major implications for the food sector that we will see in the future, I assume. Hossein, in your area of work and in your area of service, have you had any surprises?
In my area, actually, the water use has been the same as used to be in the same month of the same condition of different years. So it hasn't been changed that much. However, when I was talking to one of my colleagues in Iran, they said that the water use has been increased almost 25%. So
this is in which city?
This is in Shiraz.
Shiraz.
Yeah. So
and how big is your service area?
My service area is like 2 million people with 400,000 acre feet per year of water. So,
and can you name the cities that you're covering?
We are a county, so we are the wholesaler, and we provide it to 13 cities. So the cities of San Jose, Palo Alto, Menlo Park, and all those cities. So the thing is, it's just because our commercial and industrial side has been almost no activity there, and the people are locking and sheltering in. So it's normal to see the residential water use has been increased, and then the commercial has been decreased. So in my side, actually, I see a little bit decrease in total water use. However, as I said, there are some areas that you see the residential has been really increased 10%, 15% if they didn't have that much residential and commercial side.
So percentage-wise, how much is industrial, how much is residential in normal times?
So in my area is mostly about 60% to 70% of total water usage goes to residential, about 30% to industrial and commercial, because used to be here a lot of industries, but not that much anymore. It's more R&D. So the R&D, the buildings that don't use as much as water that they used to be in the commercial side. For the area that they don't have enough supply, treated water supply, it's a big impact. As I said, in Iran, like in Shiraz, and I heard the same thing in Tehran, they have issue with supplying the water because they have to treat that water. And you see the water going to residential, it is a high quality and treated compared to water going to commercial and industries that they don't have to treat it that much. So it's a big impact on this water suppliers. The cities, they have to provide that high quality water for drinking. And also another thing is the people now worry about the wastewater as much too. So they flushing 2-3 times to make sure the virus is not coming out from the toilet. So that's another issue that we have seen, that the people not only worry about the water quality of drinking water, also they worry about the wastewater. To me, this is a good news, because the people used to be just seeing the water as something free coming to them. There's nobody doing anything on that. They just they didn't really they take it as granted. They didn't really see it as something that is very valuable and is commodity that can be it's not available everywhere. So, And also the same thing too in the wastewater. Now everybody's like asking questions about wastewater. What's happening with the water? What's happening with this water that leaving my house? Is that the smells is gonna impact me? The mist coming out from the waste is gonna impact my health. That was another thing that I saw positive in COVID-19 that the people they did not see it before. So there's a lot of questions that's coming out, and there's a lot of research going on at this time that's a benefit to the water and wastewater system.
That's your researcher side thinking positively about this crisis, and as any other crisis, there are some positive developments that we should take advantage of. Of course, you mentioned that 30% of your water is supplied to the industrial sector, and now you're seeing a drop there, and then some increase in the residential sector. Would that affect your profit?
It does. It's not only impacting the profit of the sales of water, but also impacting because the people lost their job. And we see right now the people that they could not pay their bills is triple. Because we sell it to the retailers. The retailer already told us that they may not be able to give us the sales of water that we had projected to be part of our finance. And now we are thinking about cutting some of our projects that we were doing for long term, the capital projects, to save some money because we may not see the people being able to pay their bills. So on both sides, the reduce of use and also they're also not being able to pay the bills. The people they don't have money to pay. It's going to be impacting our revenue. So that's why.
Can you legally stop their service?
I think it's at this time the board, our decision makers decided to not stop anybody's service because this is the livelihood of the people and the health and safety. So they try to see if they can give some loan and also help assist them, given to the poor and the people who lost their job.
And is there any hope that the state would step in and try to cover your losses?
We haven't seen anything in terms of paying the bills, but we have seen some money that is state and federal. They come in to help us on the big projects for building give us low interest loans and some grants for building our projects, recycle water, treatment plant and those things. So we see some help coming out from that way compared to paying for people's bills. Interesting.
Ali, Hossein mentioned this issue of increased water use in the urban sector, and then that imposing pressure on the system. Not only we need more water, but also the system might face a capacity issue for treatment. What are your thoughts or observations of what you've heard when it comes to Iran's water supply?
According to the media reports, there are cases where water consumption at the residential level has increased in major cities like Tehran by about 15%, or other cities. There has been reports of increases in urban water consumption in the same magnitude. Now we have, the water managers have to provide a high quality water at the time of demand, because we've all learned that water is a major weapon in dealing with this disease and maintaining the safety and health of the family. So it's natural to expect that families are listening to the health professionals and using more water and washing their hands frequently. And so that naturally bumps up the water use at the residential level. But keep in mind that, although our water treatment facilities have been designed with some idle capacity, they cannot absorb a shock of just any size. So there's a limit to how much safe drinking water they can provide just based on the infrastructure capacity. For example, a city like Tehran or any city in the United States, they have a limited number of water treatment capacities, also wastewater treatment capacities to collect and treat the wastewater that comes on the other end. Now, so those shocks could be alarming in terms of the increase in residential level water use. So the water managers are rightfully pointing out the need to apply household level water conservation practices. For example, we hear that it's necessary to wash hands thoroughly by using soap for about 20 seconds, but that doesn't mean that the water needs to keep running for 20 seconds. So when you multiply the amount of water that can be saved by the number of people who are having to wash hands many more times than usual, that becomes a significant figure. So by applying those types of water conservation practices, we can guarantee that the safe drinking water can keep coming, and we don't hit those capacity constraints that cities have.
But people used to ask this question a lot from me when I was working in Iran. But let me ask you this: so total urban water use is about 6%, right? In Iran, we're talking about 92% of water use is happening in the agricultural sector, 6 to 7% in the urban sector, and 1 to 2% in the industrial sector. So why 15% increase is so significant, or 20% increase is so significant? Shall we worry about it? Plus, the country, is thankful to nature right now. For the last 2 water years, we have been seeing a lot of rain, so the reservoirs are full, and there seems to be no problem visually.
Well, that's a counterintuitive thing for a lot of people to understand, that although we say, in Iran about 6 or 7% of water is used by urban water users, this is not to say that Iran has a perfectly connected water distribution system. For example, if you're using water in an agricultural plain and you want to save water over there, you cannot overnight transfer that water to a city that is hitting its water limits. For example, you cannot instantaneously get the water from an agricultural plain to Tehran. Now we have a concentration of people living in Tehran, and this increase in residential water demand will push the system towards its capacity limits, and it can create problems for water managers to be able to meet the demand. So because the water system is not connected between industrial, agricultural, and urban water users, urban water supply system on its own becomes an important standalone system, which needs to understand its limits and how it distributes water.
And
furthermore,
so this is not specific to Iran. Even California, with such a connected system and massive water transfer system, saving water in San Jose might not necessarily help a person in San Diego.
Of course, and there is issue of different water quality standards for drinking water. And so a unit of water delivered to a household is not quite the same as a unit of water delivered to an agricultural land. So because to households, we're delivering the highest quality water. It goes through several water treatment processes to adhere to environmental standards. So it becomes very expensive, energy intensive. So it's not the same. So although it's only 6%, we can hit our capacity limits, and it's the most expensive and highest quality water that we need to protect.
So cost-wise, then there is a huge difference that the public generally doesn't pay attention to. And one reason for that might be that water is highly subsidized in Iran, so it's very cheap, and although the cost for the government is different, the cost for the users is not that different. Shall the Iranians be worried about untreated wastewater? Because Iran's capacity to collect and treat wastewater is not the same as California. We don't collect wastewater everywhere in Iran. Some of the wastewater goes into the underground resources. It goes into the aquifer. And later on, it will be used for agriculture and irrigating crops. Should we be worried? Because we are hearing that one of the methods to trace COVID-19 infection is testing and looking at the wastewater and seeing what the changes in the wastewater to find out which neighborhoods are being affected. So the virus is there.
We know that some elements, cyanide, nitrate, and all those things is going to get eventually to groundwater. But what we don't know is this COVID-19. How long does it take, if any of those is going to go to groundwater? So we don't know, because it's depend on what happened between the soil and this virus. How long it's going to be staying before going there.
What have you done to your staff? What percentage of your staff are still at work?
They are the people. We are 1/3 of our staff, because they have to work in the treatment plant. They are working at the site. The rest of them, they're working from home. The one that working in the field, in the treatment plant, we watch them every day. We take their temperature and we ask them questions and those things. Some, we didn't do that, but some other treatment plant, what they did, they brought them those mobile homes to the site, and they stayed there, and they didn't go home to their kids or their family, because we want them making sure they are not going to be infected with any disease while they're working.
And something we saw in the reports about other states, the Americans flush toilet paper and other things. There were some stories about wipes becoming problematic for treatment plants. Did you have that issue as well?
Yes, the cities that are working with us, we get the treated wastewater from them. They told us that they have so much problems. Their own employee, they were not really, some of them, they were not really happy to go there to the field and clean up some of those clogging area by wipes, because the people put in wipes in the toilet and flush it because they believe that the white people put it in the garbage, the virus is coming out and is going to be impacting them. So even the contractor that the wastewater treatment plant using, sometimes that they have more work to do, they were not really available, and they didn't want to go and do that unclogging, because of, again, they were thinking that maybe the virus, the fuel coming out from the wastewater may impact them. There are not that much studies there to tell us what exactly happening, but there's a rumor that could be, some of the fume is impacting the human health.
And Ali, are there surprises or major concerns about Iran's water situation in the months to come, or have they observed any surprises in their systems so far?
Well, I think one of the shocks we're seeing these days is related to how people are using personal protective equipment, face masks, and other things that are disposed of in the wastewater system can become problematic. And so we probably need to update our designs to add some grinders or things that can better handle solids that come in the wastewater flow. And in terms of water supply, if the current level of residential water use is to continue long term, even though we're seeing favorable precipitation conditions in Iran, and we should still be concerned about water conservation and lack thereof. And because that can become a problem in the future when we hit hotter and drier seasons, and water managers will need to struggle to continue meeting demand in the face of this crisis.
Thank you. As you both mentioned, Iranian officials also are assuring the people that the tap water is clean and they can continue using tap water. We still don't have much information and the long-term implications for wastewater and groundwater and what can happen in the food supply chain. But so far, we don't have any evidence of any major impact to worry about. Thank you both for this interesting discussion.